Welcome back, everybody. Good to see all your faces. We're going to continue. We have another speaker before our lunch hour. Before I introduce Dr. Wagner, I have an announcement. So I'm going to give a few names out here. I need the folks' names that I call to visit with folks at our registration table outside. Those folks are Elizabeth Thomas, Brenda Hagan, Chantal Bajaj, Aaron Band, Estine Guski, Lebecca Doyle, and Barbara Hashnane. If you will see the reg desk, we would love to chat with you for a moment. We need your help. All right. Thanks for coming back in. Dr. Teresa Wagner is our next speaker. She's a delight. You're going to love this. So Dr. Wagner graduated with a doctorate in public health from the University of North Texas Health Science Center, where she is currently an adjunct professor. She holds a Bachelor of Science degree in dietetics from TCU, go Frogs, and a master's degree in nutrition from Texas Women's University. She's a registered and licensed dietitian, and she has a passion for helping people navigate healthcare. This passion really was born from watching her two children, her daughters, and her recently deceased brother trying to maneuver the current healthcare environment. And as a result of her personal experiences, she chose to do her public health doctoral residency, focusing on health literacy at the University of Texas Center for Health Communication and Literacy Coalition of Central Texas. This year, she joined UNT Health Science Center, from which she graduated, their Institute for Patient Safety. She's a senior fellow leading health literacy initiatives and will assume an assistant professorship position in the School of Public Health this fall. Busy fall for Dr. Wagner. So please help me welcome our esteemed colleague, Dr. Teresa Wagner. There you go. Thank you.
Good morning. I'm really excited to be here today. As she mentioned, I'm really passionate about health literacy, and I was thinking about it this morning when I was deciding what stories to tell and not tell you guys about my health literacy adventure. And really, I started to notice the difference between communication that's delivered and communication that's understood when I was a spokesperson for the National Dairy Council. And I would go to small communities all over Texas, New Mexico, and Oklahoma to deliver messages on television, radio, newspaper, what have you. This was back before social media became really strong. And I would go to the local supermarket, which most of the time in those small towns was Walmart. And I would be shopping for my props and my food that I was going to be preparing on TV the next day. And I looked around one day when I was in a small town in New Mexico, and as I was looking around at the people shopping in the Walmart, I said, no one in this Walmart cares about what I'm making tomorrow on TV. Because I knew that the recipe I was making on TV was developed by somebody who sits in an ivory tower in Chicago, Illinois, and makes possibly for their children, but tortellini totem poles probably don't work for people who live in rural New Mexico. So that's really the first time that light went off in my head about the difference between communication that we think is happening and communication that is really happening. So let's talk a little bit about how that applies to the healthcare system. So my objectives today are to define health literacy, help you to understand the importance of health literacy, how we can improve outcomes, how we can prevent readmissions, which I know is all important to all of you, how we can apply health literate practices. So how can we change what we're doing to realize cost savings, to provide patient-centered care, and then to employ patient-centered communication moving forward. So I'm going to give you guys a little quiz, as we did earlier. And I think I skipped my first one. Yeah. So which of the following do you think is the strongest predictor of a person's health status? And I just want you to raise your hand when you think that this is the predictor. So do you think it's age? We know there's a lot of disparities surrounding different demographics when we talk about healthcare. So do you think it's age, income, literacy skills, education level, ethnic group, or the average beer intake on the weekend? So it actually is literacy skills, because if you think about it, all of these other factors don't matter if you don't have good literacy skills. So your ability to read and understand healthcare information is highly impacted by whether or not you have good literacy skills. So true or false, people will tell you if they have trouble reading. Correct. People with limited literacy have low IQs. That is also correct. And the number of years of schooling is a good guide to determine literacy level. Right, so we know that some people have made it through high school without attaining a certain level of literacy. So you can't really always determine by that. And one time, we all kind of have our things that we believe and our biases. So I've worked with not only providers, but also people out in the community in health literacy. And one time I was at a senior center, and I was delivering a talk to the participants, and this one couple asked me a question about their medication and the directions and what have you. And this little old lady that I never would have dreamed just snaps at them and says, "There are directions inside the box. All you have to do is open it up and read them," like that. And I was like, well, there goes my belief about whether this socioeconomic demographic can read the instructions. So you never know who's going to have problems. And the other thought to that is that people that are very highly educated can also have low health literacy. And it's not necessarily that they can't understand or know the words that they're reading. It's that when you're delivered a catastrophic diagnosis, you suddenly are unable to understand information that's provided to you in the way that it's being provided. So my uncle, who was a very successful businessman, top of his game, he was a banker, and he was diagnosed with prostate cancer. And so last summer, when I was still in Austin doing my residency, I told my family what I was studying. And my uncle said, "That is great. That is so needed." He said, "When I was diagnosed, they handed me a stack of papers like this and told me to go home and make some decisions." He said, "I had no idea what was going on." So again, it's not necessarily going to be the people that you suspect or expect that will have issues with health literacy. So what is health literacy? Well, this is the formal definition, the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. And isn't that our job, to help people make these decisions? And as we saw in the last presentation, consumers are the ones more and more making these decisions. So we have to be able to help them and to empower them to be able to do that. I did a study on implantable medical device websites, and I looked at them for their health literacy and also for social cognitive theory. And interestingly, just like in the last talk, the websites that had people just like me, and they were talking about their experience with that implantable medical device, were the more successful websites in terms of our scoring as to whether or not they were able to convey the information people needed to make informed decisions. So what's missing, though, in this definition? What do you guys think? It puts all the onus on the patient, right? And hasn't the healthcare system become way more complex than most patients are able to navigate or understand? So it's really, if I can get this to work, it's really a shared responsibility. And we, as the healthcare system, need to start thinking about whether or not we are providing healthcare that patients can easily navigate and make those decisions. So how many of you have seen this video on low health literacy put out by the American Medical Association? Most people have seen it, so I'm not going to show it, but basically it has patients talking about, well, you know, on my medication label, I took my pill, and then I took another one, and I needed another one, so I took another one. But on the directions, it said, take as needed. So, you know, how that is defined to different people is going to be in different ways. There's another part to this same video where a woman talks about how she woke up and had had a hysterectomy and never knew that that's what she had signed the consent form for. So, yes, there are definitely things that need to be addressed in terms of simplifying our healthcare information. So the fact is that most healthcare information is written at the 10th grade level or higher, but the average person in the US reads at an 8th grade to 5th grade level or below. Actually, I'm doing a project right now on an opioid addiction treatment program. And so one of the things that I do is I take their materials and I simplify them. And so when I was originally starting to work on these materials, when they sent them to me, I was like, oh my gosh. I mean, the words that were on these documents, there is no way somebody who's not college educated could understand. So I tested them, and they were like 17th grade level. And we're expecting patients to be able to understand this. 40% of seniors read at or below the 5th grade level, and 50% of African Americans and Hispanics read at or below the 5th grade reading level. So the key risk factors for low health literacy are elderly, members of minority groups, low income, people who did not graduate from high school, and non-native English speakers. These are groups that we would consider probably usually are health disparate populations, but like I said before, you just never know who will actually have low health literacy or be in a state of shock and not be able to assimilate information. So why is health literacy important? So having been in healthcare most of my life, I was 25 years practicing as a registered dietitian, and then 5 years ago embarked into public health with my doctorate. So I had to go back when I started working with the Literacy Coalition and look at literacy itself, because I'd never been educated on literacy. So the next thing we're going to do is I'm going to pull up a slide, and I want you all to read out loud, okay? So this is called choral reading, and we use it with our literacy classes at the Literacy Coalition. And I want you all to read it together, okay? You ready? Okay, some of you guys are sticking in there. How many of you have quit? Okay. So I know you may not be finished yet, but let's move into the questions. What is this passage about? Radiator hoses, right? And what do you need to do first? Check the upper and lower hoses. And where can you find them? So a lot of you quit before you got to that, yeah? And then for what are you inspecting the hoses? Cracks and where, yeah, right, okay. So the point of this exercise is that people with high literacy can read right through a paragraph and get the meaning, right? But people with low literacy have to focus on each word at a time. And so they lose the meaning of the greater paragraph, plus they're more likely to quit and not even read it at all. And so that's what we're doing when we're presenting people with this complex information that they can't even navigate. So patient-centered care. The American Medical Association found that poor health literacy is a stronger predictor of a person's health than age, income, employment status, education level, and race. The AMA also estimates that 90 million people in the US are low health literate. And AHRQ stated that 9 out of 10 Americans may lack the knowledge and skills needed to manage their health and prevent disease. So we're all pretty well educated in this room, right? How many of you have had a family member or yourself that's had some type of catastrophic diagnosis and really had trouble navigating the healthcare system to help them? I mean, we've all had these experiences, and we've all tried to help family members through these types of experiences, so why not make it easier? So we did start addressing this issue in 2010. The Plain Language Act of 2010 required executive agencies to use plain language in documents by 2011, October, with all communications except regulations. Are we doing this? No. And Healthy People 2020 actually started including health literacy. So we included improve the health literacy of the population and increase the proportion of persons who report that their healthcare providers have satisfactory communication skills. So it's great that we've started to address this. There's also health disparities that are addressed with health literacy. So minorities are disproportionately affected by issues with health literacy. Whereas only 15% of whites were estimated to have low health literacy, just under half of American Indians and Alaskan Natives have problems with health literacy. Over half of blacks and 2/3 of Latinos have estimated low health literacy. There's also age-related issues with health disparities when you talk about health literacy. So when we talk about what does having below 5th grade reading level mean? So these are the types of issues they could have, and we just saw an example of this, but searching a short, simple text to find out different information about a medical test or procedure that you're gonna have, giving informed consent, that's pretty important. And then adding amounts on a deposit slip, which means that could they navigate, like take 1 pill a day, take 1 pill twice a day, so simple math is even an issue. So my daughters, as was mentioned in my introduction, are both just coming of age, and so my little daughter was trying to make a medical appointment to go see a GYN. So she pulls it up on her phone, because kids do everything on their phone these days, and she's trying to make the appointment, and she's like, it says on there, what are you needing to come in for? And it has dysmenorrhea and polycystic ovary syndrome, and so she holds it out, she goes, you pick, I have no idea what this means. And I'm like, oh my God, it's health literacy. Well, then after her appointment, she had to do a 24-hour urine collection. And so they hand her this piece of paper, and it's all verbiage, just pure verbiage, like no break in no paragraphs, nothing. And so she takes a picture of it, texts it to me, and says, translate this for me, please. So I'm like, this is exactly what the problem is. So you can see, and she can read above the 5th grade level, thankfully. And then if you read at the 8th grade level, you would have still difficulty filling out a health insurance or medical history form. In fact, I was sitting at my GYN's office the other day and saw a woman having her son translate that form for her. And I'm like, I wonder if he really understands what he's saying. Accurately following prescription medicine label instructions, and then comparing generic and name brand medicines for price and side effects. So interestingly, at one of my senior citizen, I have a million stories, so I probably shouldn't tell them all or we'll be here all day, but I was at a senior citizen center, and one of the little women, it's funny because when you go and you actually pay attention to them, they love it. Like, that's what they need. And so this little woman was telling me that I cannot take the generic brand of my medicine, but every time I go to the pharmacy, they give that to me. They don't give me the regular brand. And I said, well, next time you go to the pharmacy, why don't you tell the pharmacist that you have to have the regular brand because you can't take the generic? And she just looked at me. And I had just given her the biggest gift ever. But she hadn't been taking her medicine because of that reason. So it's just these little things that if we could just step in and really pay attention and help these people that, have issues. And just assume everyone has an issue. That's called health literacy universal precautions. Assume everyone has an issue and try to help them understand as best possible. So there's age-related health disparities as well. And you'll notice that the groups that have the most problem are the young, 16 to 18, and the older. And so having watched my daughters go through this transition, I can understand why that group is high risk, because they don't know yet. They don't have that efficacy to assert themselves and ask questions of their doctors and all of these things. So I've trained my little one, like, did you ask this question? Did you do this? Did you tell them no? Did you, and she does that now. But I always think to myself, there's a million people that don't have somebody standing over them going, did you do this? Did you ask this? So that's why we need to make it easy for people. So here's where patient safety comes in. When we look at issues with health literacy, in peer-reviewed research, low health literacy has been linked to poor outcomes. These outcomes, such as not being able to understand their labels and on their medications and health messages. They can't follow the medication instructions. They have a lower likelihood of accessing and receiving preventive care. And we'll look at some of the reasons that that's an issue as well. They have more hospitalizations, worse overall health status, higher mortality among the elderly, shorter life expectancy, worse physical and mental health, and greater use of emergency departments. And that's what we're trying to reduce, right? So also, there's higher risk of legal risk and sentinel events. Communication problems are the most common cause of medical errors. Now that should speak volumes, right? Miscommunication is the leading cause for patient dissatisfaction, which increases the risk for lawsuits. And increased malpractice cases are ruled in favor of patients who are not appropriately informed about medical decisions. So we have to be documenting that we're communicating in a clear way, in the language and in the way that that patient can understand. Patients who miss appointments may have a viable lawsuit if they can prove their failed appointment resulted in harm due to a doctor's unclear, inadequate, or omitted instructions. So what do we generally label patients who miss appointments? Non-compliant. But let me tell you, when I was in Austin doing my residency, I heard from so many patients what a struggle it is to know when they're supposed to be coming back, or to understand, or be able to call, or any of these things. And so I grew to understand why health literacy is such a huge issue. 65% of sentinel events reported to Joint Commission have communication as the root cause of that failure. And you remember in the last presentation, she said we need to find the root cause. Well, here it is. Providers are increasingly held liable for errors due to miscommunication and lack of patient understanding that results in harm of a patient. And communication issues are among the most cited causes of underlying medical malpractice lawsuits. So preventable readmissions. 18.7% of patients are readmitted to the hospital with the same or similar condition within 30 days of discharge. When I worked as a registered dietitian, so while I was in my doctorate, I had a lot of different part-time jobs, and one of them was at a rehab hospital. And one of the things that was the most frustrating to me working there was that we would get them strong and healthy because they were eating 3 meals a day and they were doing their physical therapy, and we would discharge them and they wouldn't be successful once they went home. One of the things I couldn't get for them was supplements once they left because of insurance issues or lack of